Hello, I am Thomas McNamara, Medical Scribe and Director of Patient Education at Buffalo Endovascular and Vascular Surgical Associates. Today I will be walking you through the steps of the Endovascular Abdominal Aortic Aneurysm Repair procedure, which we refer to as EVAR. The goal of this video is to ensure that our patients understand the role this innovative treatment option plays in preventing aneurysm rupture. We hope that this video and our website can help educate patients and their families on EVAR and put their minds at ease as we partner together to prevent aneurysm rupture. The aorta is the body's largest blood vessel and is responsible for carrying about 2,000 gallons of blood from the heart to the rest of your body each and every day. The lower part of the aorta, in between the chest and the hips, is called the abdominal aorta, and this is pictured on the graphic on the left in the square, and this is the part that we're interested in. The abdominal aorta is responsible for transporting blood to the abdominal organs, pelvic organs, and your legs. Aging and certain risk factors make the abdominal aorta a common spot for aneurysm development. An abdominal aortic aneurysm, or AAA, is basically a bulging or ballooning of the blood vessel, which occurs when blood pushes against a weakened or damaged artery wall. So why are AAAs a serious healthcare issue? First, a lot of people have them. Approximately 10 to 20% of the population older than 60 has a AAA. And the incidence or the frequency of people that have them increases significantly in men after the age of 55 and women after the age of 70. In addition, AAAs are often called the silent killer. AAAs do not have any symptoms until rupture in most people. And a ruptured AAA is the 13th leading cause of death in the US. So this is why it is really important that we diagnose and treat a AAA before it ruptures. So what are the risk factors for AAA growth? The first is old age. As we get older, our blood vessels become weaker and are more likely to form an aneurysm. Another is family history. A lot of patients with AAAs have a genetic predisposition towards forming an aneurysm, and up to 30% of patients with a AAA have a relative with the same condition. So it is important as a patient with a AAA to make sure that your siblings and children are properly screened. Some risk factors we can control are tobacco use. Smoking increases the rate of enlargement of an aneurysm by 35%. So it's important to engage in smoking cessation. In addition, high blood pressure is another risk factor. As our blood pressure gets higher, it's going to push more and more on the aneurysm and cause it to grow. If an aneurysm is left untreated, it could rupture over time, especially if it's over 5 centimeters. So this graph shows that as the size of the aneurysm increases, the risk of rupture increases as well. And usually the threshold is around 5 centimeters. So fortunately, the surgeons at BEVSA offer a minimally invasive, low-risk procedure to prevent aneurysm rupture. As a patient with a AAA, it is important to understand the associated signs and symptoms. And again, I'm going to reiterate that if you are experiencing symptoms, it usually means that your AAA has ruptured. So these symptoms would be severe back pain, severe abdominal pain, severe flank pain. This is more than the usual aches and pains that a lot of patients have with their backs. And if you experience any of these symptoms, it is important to call us or 911 immediately. Until very recently, aneurysm repair was a major open surgery requiring a large incision in the abdomen, as pictured on the left. However, our surgeons at BEVSA are well trained and experienced in a new, minimally invasive option that has much smaller incisions, less complications, and a shorter procedure time and hospital stay. Most patients here at BEVSA tolerate the procedure very well and are able to leave the hospital within a day or two. For the procedure, you are admitted to the hospital the same day as your procedure. Most patients are put to sleep under general anesthesia. And here's a picture of that small puncture site I was talking about that our surgeons specialize in, which is minimally invasive. And the procedure takes about 2 to 4 hours. So there's the aneurysm, and those 2 wires are guide wires that we put in to allow us to place the endograft. So this sheath that's being brought up is going to have the endograft in it to place over the aneurysm. So the first thing that we're going to do is we have to create the body of the graft. And we're going to do that with a liquid polymer. So the bottom half on the left shows us what's happening outside of the body. And this is where we're going to inject the liquid polymer, which is going to then travel and create the graft. And the polymer acts as a mold that hardens and creates a customized shape to the patient's vessel structure. This ensures a tight seal. So here's the polymer being injected, and as you can see, it's starting to form the body of the graft. Now that we've formed the body of the graft, now we have to extend the graft via 2 more limbs. And these limbs are going to ensure that the entire aneurysm is cut off from blood flow. So on the top, you can see now we're deploying the iliac limb, which is going to connect the body of the graft to the iliac arteries. So this graphic gives you an idea of that limb that we just added. You can see that white part extending from the body of the graft to the iliac artery. So next, we are going to balloon the top part of the graft, and we're going to add saline to inflate a balloon, and that balloon is going to create a very tight seal at the top to ensure that no blood can get around the graft into your aneurysm sac. After that, we're going to add the third and final piece, which is that additional limb on the left side. And this is going to be another iliac limb, and now we have a complete graft from top to bottom. And then the final thing we do is we do a completion angiogram to ensure that there's no flow into the sac. So as you can see, the dark color, which is the blood, it's in the contrast, it's traveling through the graft to your legs, and you don't see anything in the sac lighting up, which means that blood flow has now been blocked from the sac, and that way it won't rupture. Most patients are discharged the following day after the procedure. We ask that you do not lift or pull anything more than 10 pounds for 2 weeks. We also ask that you do not drive for 2 weeks. These allow you to fully recover from your surgery. We also ask that you do not return to work until you're cleared by the vascular surgeons at BEVSA. We also ask that you keep your groin dressings in place for 5 days after the procedure. Most importantly, you must continue to follow up with us. And this is because the procedure that you're having means that we're forming a relationship with one another. And we want you to come back, and we're going to take pictures just to make sure that the graft's in the right place. Because the aorta is a living vessel, and it can change shape, it can move, and we want to make sure that the graft keeps that tight seal and blocks off your aneurysm. So over here on the left, here's a in-procedure picture of an aneurysm. You can see it looks like a big water balloon over here on the left. And over here on the right, this is a picture taken a few months after the procedure, and you can see actually a really good sign that the procedure works is your aneurysm shrinks over time because there's no blood flow keeping it ballooned out. So that's another reason we want to take pictures, is to see, does your aneurysm sac start to decrease over time, which is a great sign. The newly placed graft in the abdominal aortic artery helps put patients at ease, as they now have significantly reduced their risk of aneurysm rupture thanks to this minimally invasive, innovative procedure offered by our talented surgeons at BEVSA. If you have any questions, please refer to your surgical instruction sheet, our website, and our staff for more information. Thank you for choosing BEVSA and our physicians for your aneurysm care.